Hello, everybody, and welcome. Welcome. Thank you for being here today. Welcome to another one of the Haiti COVID-19 Preventative Response Consortium's webinar. We're so pleased to have so many people from both Haiti and the United States joining with us here today. We will be recording and live streaming this event, and we'll share that link with you down below in the chat. We'll be sharing it on Facebook and on YouTube, so please share with your friends, let them know what's going on today. And I'd like to start today off with a prayer for unity. Oh my God, unite the hearts of thy servants and reveal to them thy great purpose. May they follow thy commandments and abide in thy law. Help them, O God, in their endeavor, and grant them strength to serve thee. O God, leave them not to themselves, but guide their steps by the light of thy knowledge, and cheer their hearts by thy love. Verily, thou art their helper and their Lord. Now I'd like to turn things over to our moderator and our chairman for today, David Hoffman. He is the board president of the Raising Haiti Foundation. So thank you again, and here's David.
Thank you, Mariah. And thank you all for joining us, for being here today. We're going to begin with kind of an overview of what's happening in Haiti. And we're pleased to have with us today Bettina Obersteiner. She's the foreign policy manager at the Clinton Foundation, where she runs the Haiti Action Network, assists President Clinton in preparing for all foreign engagement, and helps to guide foundation initiatives and relationships abroad. Bettina holds an MSc in International Public Management from the Paris School of International Affairs and a BA from the University of Pennsylvania, where she majored in global health. Her writing has appeared in New Eastern Europe. Welcome, Bettina. Welcome to the chat.
Thank you so much, David. Thanks for having me. Very much appreciated. I'll get right into it since we have a lot to go over. As I'm sure you're all aware, Haiti has really been in the trenches since mid-2018 due to an ongoing economic crisis, as well as due to social unrest and political instability that have all really combined to, unfortunately, worsen Haiti's outlook when it comes to, potentially bouncing back from the effects of the coronavirus pandemic. Fortunately, if there's one good thing to note, it seems like the political situation seems to have calmed just a little bit since Haiti's new prime minister was appointed in March, which was just before the coronavirus arrived in the country. However, the truth is that this pandemic has really only quickened the pace of Haiti's existing economic crisis and exacerbated already significant inflation. And now we're actually at the point where the IMF predicts that Haiti's GDP will contract by at least 4% in 2020, which would actually amount to the largest contraction annually for Haiti since the 2010 earthquake. One contributing factor, of course, is the fact that Haiti continues to be in a state of emergency, like a lot of us, with non-essential sectors shut down since March. This, unfortunately, has resulted in really a massive crisis for the ordinary Haitian family, especially as the government really doesn't have a traditional unemployment scheme, or what it does have is quite modest. And I'd also note, though, that although the state of emergency in Haiti has now been extended through July, the informal, economy and the informal sector really continues to function because local governments are struggling to enforce the lockdown. And, at the same time, people are having to make the choice whether to go to work or whether to stay home or whether to go to work and feed their families. somewhat controversially, the government did decide to partially reopen textile factories in April. This was really criticized by health experts, but on the other side, praised by workers' unions. Certainly, if anything, it has at least helped to continue sending paychecks to a proportion of, around 60,000 Haitians who work in textile factories. So also just adding to Haiti's economic woes here, remittances, which in a normal year would amount to around 34% of Haiti's GDP, are unfortunately dropping as Haitian communities in the US and Canada in particular really suffer the economic consequences of this pandemic as well. I would also say that it's difficult to pinpoint the actual numbers, but it's thought that tens of thousands of Haitians working in the Dominican Republic have already returned or are planning to return back home to Haiti over the shared land border between the two countries. And many of these Haitians lost their jobs in the Dominican Republic, where the economy and particularly the tourism industry is really being decimated by this pandemic. And while I won't get into the health aspects of this migratory trend, I would just say that this is really an economic concern as well, because we're just adding to the quite large population of unemployed people in Haiti. It's also worth noting that Haiti continues to suffer from quite severe fuel shortage, which of course has been ongoing for a very long time now, since long before this, since the virus arrived in Haiti. And so, when you look at all of these trends and all of these unfortunate realities in Haiti, what we're really ending up with economically is the groundwork being laid for a famine. So to put this economic situation in context here, in 2019, before the virus even was on anyone's radar, between 30 to 40% of Haitians were food insecure or in dire need of food assistance. So we also have to consider the fact that the pandemic is now also resulting in less food coming into Haiti and decreased availability of seed for domestic farmers, and really just painting quite a poor picture for the future when it comes to hunger in Haiti. Just to quickly touch on the current situation of the international community when it comes to Haiti with its struggles to deal with this pandemic. Sadly, the US, which has of course historically been a large source of support in times of humanitarian crises, has really not been in the picture during this crisis. The IMF and the World Bank and the EU have pledged a few $100 million in aid to Haiti, but it's kind of up in the air really how long it will take for all of this funding to be dispersed. And worth noting that this funding, only a proportion of it is going to budget support to help the government pay its public employees and subsidies and so on. So to, add insult to injury here, we've also seen a lot of recent, predictions that the 2020 Atlantic hurricane season is going to be particularly aggressive. So, we can only imagine, undoubtedly, if Haiti were to receive another economic blow in the form of a natural disaster, it's really hard to overstate how devastating this would be. And just because it's worth mentioning here, I would just briefly add that a further complicating factor here to the political and economic situation in Haiti is the uptick that we've seen in criminal and gang activity, particularly in Port-au-Prince, which of course is just contributing to this overall deterioration of the security situation in Haiti. So with apologies for painting a rather grim sad picture, I will end my update there.
Bettina, thank you for being here, sharing some very sobering news and concern that we all have. Thank you for being here. Next, I'd like to welcome Dr. Nat Seguerin. Dr. Seguerin is County Director for the Caris Foundation in Haiti. After medical school at Cambridge University, Nat completed his residency in pediatrics at Guy's and St. Thomas's Hospitals in London. He's a member of the Royal College of Pediatrics and Child Health. As a Fulbright scholar, Nat completed an MBA and an MPH at Johns Hopkins. He helped initiate the Caris Foundation's activities in Haiti, which have grown from supporting one hospital to over 125 clinic sites in every province of the country. Nat, welcome.
Thank you, David. Thank you, everybody. So I was asked us to give a quick update on the situation, the health situation in Haiti regarding COVID. And I think now we can say we're really firmly established in the middle of the pandemic. And, I think the number of cases is greatly increasing. Over the last 10 days, we've been having between 100 and 200 new cases per day. And of this, we know, of course, is severely underreported due to the complications of testing availability in Haiti. Currently, as of yesterday, the official report is at 1,865 cases with 41 deaths. Even yesterday, there were 281 cases diagnosed in just a 24-hour period. The lab, I think, is, extremely busy. The two labs are extremely busy. And, 2-3 weeks ago, you could get the test result back in 24 to 48 hours. And now it's taking at least a week. So we're going to see, large increases in numbers as the lab is able to catch up. So to compare with the Dominican Republic, our closest neighbor, they have 17,000 cases as of yesterday, 502 deaths. And if we look at their trajectory, it seems they're still increasing, in a linear way, the number of new cases, but the deaths seem to be stabilizing. And I think, Haiti, I think, is at least 3 to 4 weeks behind that scale. And I still expect the peak of Haiti to be reached within the next 2 to 3 weeks. There are cases in every department, all 10 departments. So that gives us a very good indication that the epidemic is spread throughout the population, is spreading between members of the population. Île Vache, one of the small islands to the south of the country, has had its first case. So now, these even very remote communities are being infected too. Still, the big challenges for us in the health system is the number of intensive care beds available. All of the intensive care beds in Haiti are currently occupied. So there's no excess capacity. So, those who are extremely unwell, there really remains very little for us to be able to do with them. The number of oxygen bottles, which is the mainstay of treatment, again, is very, very low. And we're just able to start shipping those supplies from the US and from all over the world. Now they're beginning to arrive now. We have 150 oxygen concentrating machines that should be released from customs within the next week. They're currently in Haiti too. So a lot of the things that have been ordered are beginning to arrive. There are large delays in customs right now for even humanitarian products leaving customs. So again, previously 2 to 3 weeks ago, you could get things out within 2 days or 3 days, but now it's taking over a week, which again is contributing to kind of problems. Almost all of the sites that have been designated as COVID treatment sites have received some form of PPE, protection gowns and gloves and masks, etc. But that is a very small number of sites in comparison to the rest of the health system. Probably less than 40 sites have been kind of designated these treatment areas, treatment-specific sites. That means many of the smaller hospitals and clinics that are still seeing patients present with respiratory symptoms really don't have much protection at all. We have been working to give fabric masks to all staff and all at-risk patients, such as those living with HIV and tuberculosis, and that's being done now. All of the CARIS sites, about 164 sites, have received pulse oximeters, which are very useful in diagnosing cases and stratifying risk for patients and referring them on. One of the biggest challenges, I guess, still is the stigma and fear about the illness. Patients are coming to hospitals, quite sick, and then are being asked to stay for treatment in the kind of corona zones, and are not willing to be admitted and returning home, only to return much later, a day later, to another place. So there is some kind of stigma and fear of patients to be treated, and often this does not lead to good outcomes for those patients that leave hospital and refuse treatment. I think that the things that we'll need to start thinking about now is really the disposal of bodies. We still have a very large shortage of body bags. They still haven't arrived in any great quantity, and we're going to have to start working on training sites and training the parishes and training hospitals how to deal with bodies with suspected COVID to prevent further infection. The training, I think, in the community is going well. We have been able to use the comic that I'm sure will be discussed later, and distribute that widely to schools and young people in the parishes too. The parish programming of training leaders within twinned church communities, Haitian communities, seems to be working well and getting good exposure. And I think we're starting to move towards kind of radio and mass communication messages. I think right now we're at that real beginning of the peak, and the next 2 to 4 weeks, 2 to 6 weeks really are going to be critical as we see the full extent of the epidemic. I think that's my update there, David.
Thank you so much, Nat. Again, a bleak picture, but we appreciate your sharing it, and also the extraordinary support from you and from CARIS. What we're hearing, the physicians have handled a number of trainings, and with the national campaign, the Tanama campaign that you all have helped fund as well. We thank you so much for your participation. Our next presenter, Dr. Sue Carlson, is a retired ophthalmologist who has worked for 20 years with the people of Médor, Haiti, through the Haiti Committee at her church, Our Lady Queen of Peace. The twinning between her church and St. Joseph Parish in Médor began in 1997 as part of the Parish Twinning Program of the Americas. And in addition to Our Lady Queen of Peace Haiti Committee, I'm so pleased to let you know that Sue is serving as a volunteer executive director for the Raising Haiti Foundation. Volunteer or otherwise, I don't think we could possibly have found a better, more suited person for this task. She's been with us for the last 3 years, and I don't think we'd even still be here if it wasn't for you. So welcome, Sue.
Thank you. Let's see. I'm just going to pull up the slideshow. So first, I just wanted to say that when we met last time, it was Mother's Day in the United States, and we were wishing all the moms here happy Mother's Day. Well, today it's Mother's Day in Haiti, and I know everybody wants to wish all the moms in Haiti a wonderful day. And we're going to just do a little update on what's going on with the Haiti COVID-19 preventative response, which we're nicknaming Haiti-CPR. And we're convinced that it's going to help save lives throughout Haiti. And this is just a summary of what's been going on. We're training 10-member community teams who then educate their communities about social distancing and COVID-19 prevention. For each community, we're also providing a prevention kit. And the service is available for the first 121 communities that enroll. So this is a photo of one of the distance trainings, and we call it distance training because the trainer, the doctor, is not actually in the community being trained, but connects with these community leaders by cell phone. And the cell phone is put on speaker mode or else is connected to an ancillary speaker, as in this photo. And the doctor gives a half an hour instruction followed by a 30-minute question and answer period. So the training is going to be conducted in 121 communities, give or take. There are 10 people at each event. So that means there'll be 1,200 people, 210 people trained. And then these people go and train their own communities. So a total of 12,100 people will be trained, and then they just spread the word to as many people as possible in their communities. This is a photo of the brochure that's given to the people being trained. It's a Caris Foundation brochure that was the comic book characters are from Tony Louis, who you'll meet a little bit later in this program. And so the kits that are supplied to each community consist of 10 hand washing stations, 100 masks, 100 brochures, and 2 megaphones. All these things to try to help spread the word. If you would like to enroll in the program, this is the enrollment form that needs to be completed and sent to me, as well as to Teresa Patterson. Both email addresses are here, and you don't have to write it down. We're going to be sending out a copy of this slideshow to everybody who registered, so you can get the information then. If you want to learn more about the organizations that came together forming the Haiti-CPR Consortium, it's on this slide, and you can check out those web addresses. And now I'm going to turn it back over to David.
Thank you, Sue. Next up, I'd like to introduce our coordinator for this campaign, this initiative in Haiti on the ground. I like to call him our Haitian general on the ground. Jean Godinson Antoine is a HELP, Haitian Education Leadership Program, merit-based scholar and alumni who studied computer sciences 2000 through 2004 at École, I don't know that I can pronounce this, Supérieure I didn't see this before. Well, I'll let him tell you. Currently completing a CILT Level 5 diploma with the Chartered Institute of Logistics and Transport in the UK. From 2007, Godinson worked for the United Nations peacekeeping mission, first in Haiti. And he's on a mission to instill motivation and hope in Haiti to counter the spirit of despair that has ravaged Haiti more than any single disaster. Welcome, Godinson. Welcome to the chat.
Thank you, David. My name is Godinson. I studied computer science from École Supérieure Informatique d'Haïti, which is AZ in spelling in French. Very delighted to be part of this program. As we can see that our training, we've completed so far 45 training on the 106 communities and parishes that we have registered so far. And still we have 21 training scheduled for this coming week. And that's 20% being planned for the next week. And we are pending to reach out to 40 other communities and parishes. That's 28%. And in our training conducted, it's mostly our distance training is conducted by a Caris Foundation physician. And in phase 1 pilot, we had been having 2 training per day, and we were doing only distance training for those program, for those communities. Now we are going to start phase 2 of the program in June 1st, and we are going to increase training up to 8 per day, starting Monday, because we'll be able to use the conference call feature in our phones, so we can have like 2 or 3 communities connected together in one session. And also the kits normally should be delivered in advance of training, but as we know, because of all the challenges, we conduct some training that are pending to receive the kits. Distribution of kits also of phase 1 is will be processed starting next week. Now, how the program works? Actually, when we receive the requests from communities and parishes through our Parish Twinning Program or directly through our liaison, the first step is to communicate with the community leader, and either face-to-face, like through our liaison community, or by phone or internet, to explain them what is the project, what the Haiti-CPR is, or how it works, what are the expectations they can get from us, and what not to expect, because as you know, there are so many expectations that can be bring up during such a program. So in step 2, we discuss with the leader the responsibilities of the leader and the participants, so that they know it's an empowering program where we don't say we'll do everything. We will empower the communities and to go out there and help save lives to the communities. In step 3, we schedule the training with the community leader and the clarification in a few days in advance. So the clarification will know, like in a week or 2 or 3 days earlier, when what time will be the sessions. And in step 4, we arrange for COVID-19 prevention brochure to get the community before the training. That's the ideal process, to get the brochures before the training. But if not, we make sure that we provide the training version to our leaders via WhatsApp. In step 5, so we have the training being taken place, where participants are seated with a mask and respecting the distance, social distance, so that we really good position to receive the training and know what to do when we do the next step. And in step 6, so we keep in touch with the community, following up to know if the leader receiving the training have gone out to their communities and do their second or third training. We have a WhatsApp group created for each community that we have training with, and we get in touch and receive their feedback from now on. Now, let's have a quick picture of the kits distribution by departments. It's more or less, so far we have 85 training, communities listed here, but we had another 16 that were done before us. But we know now by June 5, we are looking to having all kits shipped to the activated area. And by Tuesday, we're using unlocking a community partnership where they will deliver the kits to the center, like Thomasik, Dalaga, and Batizim. In the West, by Wednesday, June 3rd, we will be able to get them those items. And Grand Dance, which have a big spot, we are coordinating with a local partner, Damon, who knows different parishes, and see how we can use the Caritas facilities to reach out to the parishes in Grand Dance. There are 53. in Southeast also by the same week after next week, and also the South, because these are not the same way, and then the North as well by June 10th. So it's a manner of for us to have a planning and see how we can move things faster. Now, the training, as we mentioned earlier, Dr. Alan Jeffrey, who is one of the main doctors that do the training for us from Haiti Foundation, and he has done most of the training, up till now. But we were fortunate last week to have Dr. Libris Prevelis, who is working for Our Lady of Miracles Parish in Gobert in North, and he will start conducting a daily training for us starting next week. There are 20 trainings scheduled for June, from June to 5, so that's a big set for next week, and we hope to make them happen. Thank you. I appreciate. Thank you all. And I'm back to David. Thank you for.
Thank you so much. Yeah. Thank you, Godinson. You've got your running shoes out. Godinson's only been on the job now for a few weeks, but it's just amazing how much you've accomplished so quickly. We're delighted to have you handling things in Haiti. Thank you for that up-to-the-minute report. I'd like to introduce next Timothée George. Timothée was born in Haiti in 1978. He studied natural resources and peace at the United Nations mandated University for Peace in Costa Rica. At UPeace, he co-authored the book, The Fabric of Community, with Earth Charter staff members. And since 2008, Timothée has been deeply involved in environmental rehabilitation, natural resource management, and community capacity building. In 2012, he co-founded the Smallholder Farmers Alliance, a Haitian community-based grassroots organization. He serves on that board, and he also serves on the board now of the Raising Haiti Foundation and is one of its executive committee members as well. Timothée lives in Haiti. His dream is to help create sustainability for an ecologically safer world. Timothée, welcome to the chat.
Thank you, David, and thank you to all the participants to this important chat this afternoon. So while I'm speaking, you will see some of the slides about my speech. As you probably hear from previous speakers, the situation in Haiti has multiple dimensions. For example, the circumstances of political instability in Haiti that put farmers out of business almost for the entire year of 2019. And now we have in COVID-19 that only amplifies existing challenges. So right after this outbreak, this pandemic outbreak announcement was formed the Haiti-CPR that delivers training prevention kits, hand washing stations, and face masks to communities. And in parallel, we were very conscious that we should help those people live in the remote areas of Haiti and improving the resiliency. I'm speaking about 500,000 and more farmers in the rural Haiti. So for the last 3 months, Haiti-CPR had contributed, and we were able to hand agricultural hand tools, livestock, and training on agriculture to communities. And in addition to that, 10,000 pounds of short-term harvest crops. Among those are peanuts, black beans, pigeon pea, maize, sorghum, carrot, leeks. All these crops we were able to lend to about 500 farmers, and it's an ongoing work right now. And that is only a portion of what we SFA is doing in Haiti. So we were also able to purchase tubers like yam, if you know that crop, and about 500 kilos of tubers for the farmers. So by helping people on agricultural side, we are improving the resiliency during this crisis. Because as a summary, Haiti has two problems right now. People are sick and they're also angry. So Haiti-CPR is trying to respond to both situations. So thank you very much, guys. And if you have questions, I may be able to respond to afterwards.
Timothée, thank you so much and for all of your effort. Timothée leads all of Smallholder Farmer Alliance's operations on the ground and has done so for many years, and a more reliable partner could not be found. We're delighted to have you here with us today. Tanama is the creation of Haitian comic book artist Tony Louis, who developed the storyline to reflect the real-life experience of the Smallholder Farmers Alliance and their members who plant millions of trees and provide targeted support to women farmers. Tony was mentored by Rich Buckler, the legendary comic artist known for his work with Marvel and DC Comics. In November 2019, Tony was artist in residence at Purchase College in New York, which included an exhibition of his work. We're so delighted to have you here with us today, Tony. Welcome to the chat.
Hello. Hi, everyone. Can you hear me?
Yes, we can.
All right. I'm happy to be with you guys and presenting Tanama and be part of this amazing project. And like you mentioned, I created Tanama, and before Tanama, I created several other superheroes such as Jitao, and afterwards, I created Tanama. But I maybe 4 months after that, I was introduced to Hugh Locke. That was maybe 6 years ago, and we reshaped together the story of Tanama and because I really love the vision of SFA about the mission, what they're doing in Haiti, and it gives Tanama more depth in her creative process. And Tanama has a mission to plant trees and to talk about gender equality in the farms, and that's what we've been doing. The comic book has been launched in early March, and we had the opportunity to launch the comic book with She Builds, with Small Farmers Alliance, also with Profaz, and it was really amazing. We had the possibility to introduce it to several schools in Haiti before coronavirus strikes, and with the help of Caris Foundation and Small Farmers Alliance, we created a campaign to sensitize the people in Haiti about the situation of the COVID-19, and in the thought process, in brainstorming about the campaign, I proposed that we do a challenge. We call it Tanama Prevention Challenge, and it includes a lot of famous Haitian artists that answered the call. I would say when I asked them if they can take part of this challenge, they automatically say yes. And with all of them together, we have at least 2 million views of the first challenge of Tanama. We have a second one too. The second one reached out more and more. People were able to see the importance of and washing and wearing a mask in Haiti. And this national campaign is, to me, it's really important and efficient because it reaches out to young people, and not only to young people, but to all type of ages or social background in Haiti, because it's fun and it includes a lot of great artists, Haitian artists. And the campaign, I feel like the campaign, not only with the challenge, but we developed brochures and small stories with illustrations about social distancing and the wearing mask. Also, when somebody's infected with the virus, how their family and how the right attitude basically to have when facing someone who has COVID-19. And I'm not sure if there's slides about it, but maybe later on we can show these slides. And currently we are also working. It's done a comic book, a short story about stigmatization when someone is infected with. Oh, there you go. This is the short story, the first one of the first one with all the taxi motorcycles, and we talk about social distancing. And this is the poster. It's also it's a short story about stigmatization and people who are angry about someone who's infected with the virus, and how Tanama comes in and tell the people that it's not right what you guys are doing, because even your family or a friend or your loved one can be infected too. So you have to be conscious about your actions, and that's basically it. Well, this is it. That's the first challenge, and I have a third one coming next week. More Haitian artists are
Tony,
yes.
thank you so much. I mean, very cool work. 2 million views almost overnight for that video, right?
Oh yes, and it's increasing because people are still looking at it. And this is only on Instagram, and not counting their Facebook page, their Twitter. So it's really great.
Well, it's a very important awareness campaign. It's gone national. You have billboards and many other assets as well. And thank you so much for your hard work and creativity. It's great to have you here.
Thank you for receiving me.
Next, I would like to introduce to you she'll be embarrassed if I say it, but a legend in Haiti. Teresa Patterson is the co-founder and executive director of the Parish Twinning Program of the Americas that has facilitated and maintained 302 linkages between Catholic parishes in the United States, with over 225 parish communities in Haiti and another 48 in Latin America. She is also the founder and executive director of the Visitation Hospital Foundation that operates a large clinic in Petite Rivière de Nips in Haiti. Welcome, Teresa. So nice to have you.
Thank you, David. Over the past year, the Parish Twinning Program of the Americas has been working together with Raising Haiti Foundation and the Smallholder Farmers Alliance, developing the Community Twinning Initiative in which smallholder farmers work their way out of extreme poverty through a combination of tree planting and improved agricultural practices. For PTPA, this collaboration has provided a new set of resources that twin parishes can tap into in order to effect meaningful change and improve the lives of people in rural communities throughout Haiti. Then along came COVID-19, and the three organizations knew we had no option but to channel nearly all of our focus on helping to mitigate the terrible impact of this coronavirus in Haiti. Together with other partners, we established, as has been mentioned, the CPR, the COVID-19 Preventive Response Consortium. I believe that Smallholder Farmers Alliance approach has been phenomenal. They have built an innovative tree currency system that allows farmers to reduce their cost of operation by earning agricultural credits for seed, tools, training, and financing in return for planting trees. One of our twinning parishes, St. Mary's in Huntley, Illinois, partnered with SFA over a year ago, and they have already planted 12,000 trees in the first year and hope to plant 40,000 in the second year. They started out with 200 farmers and now have 500 participating in tree currency. Imagine how far-reaching this initiative has been in 1 year in terms of economic empowerment, food and job security, and climate change. Haiti faces one of the most severe environmental crises in the world, but it is not beyond hope with programs like the tree currency. The country's ecological devastation affects every aspect of politics, culture, and economy, but the tide can be turned through education, training, and support of the local farmers and parish communities. I know that many of you in the twinning program are always looking for additional ways to impact your parish communities through sustainable programs. You have an amazing opportunity through the Smallholder Farmers Alliance to reverse the ecological damage in Haiti by simply appealing to members of your parish or community to invest in the future of Haiti. Because I feel so strongly that we must do what we can to protect Haiti's land and its people, it gives me great pleasure to be able to introduce one of the creators of the Tree Currency Program, Hugh Locke. Hugh Locke is president and co-founder of the Smallholder Farmers Alliance in Haiti. Hugh is an author, co-subject of the documentary Combit, the Cooperative, and frequent speaker at forums as diverse as TEDx, Said Business School at Oxford University, the Clinton Global Initiative, and the Parliament of the World's Religions. He also writes a popular newspaper blog that aims to interpret the complex state of current affairs in Haiti for an international audience. Hugh is a member of the Baha'i Faith and early in his career was director of the Office of Public Affairs for the Baha'i International Community. And here's Hugh.
Thank you, Teresa. I wanted to start by just giving you a very basic overview of the program that Timothée, George, and I conceived of. And it all starts with tree nurseries. These are very simple enterprises, and they run entirely off the grid. So there's no electricity, there's no running water, and all of the land on which the nurseries operate has to be donated by the community. And the idea is that local farmers are invited to grow, transplant, and look after trees that they grow themselves in these nurseries, transplant onto their own land, onto community-owned land, onto areas that are being reforested, and then they look after those trees. And that process of growing, transplanting, and looking after trees earns them what we call tree currency. So the next slide, please. So by planting trees, they get credits. And these credits, we refer to this as tree currency. So we don't pay the farmers in cash at any time. What we do is to provide them a range of services that they've earned through the process of planting trees. Next one. This translates to 3 basic things that every one of our locations provides. So as the farmers plant trees, they earn seeds. So that's better quality seeds for their farms. This is open pollinated, non-hybrid seeds, because our entire operation is run on organic principles. They also are able to earn tools like the hoe this guy is carrying, because those kinds of tools are very expensive. And they earn training to help improve the quality of their agriculture. One of the challenging facts is that most smallholder farmers in Haiti, and as Timothée mentioned earlier, there are an estimated 500,000 smallholder farms, and a smallholder farm is 5 acres or 2 hectares or less. And the people who live and work on those farms, on average, have never met anyone from the Ministry of Agriculture. There are some very highly qualified agronomists who work for the Ministry of Agriculture, but they're very handicapped because of lack of funds to be able to go into the community and help provide the kind of training which now we're able to provide. So this combination of providing seeds, tools, and training for the smallholder farmers means that their yields go up an average of at least 40%. But at the same time, their input costs have gone down because they've earned these things. So their net increase in income is generally between 50 and 100%, depending on where they are. Now that last image there for loans, while we provide these 3 basic services, seed, tools, and training, in every location where we operate, in some of the locations we also provide additional ways in which those farm credits can be used. And one of the most popular is providing low-cost loans for women farmers to be able to do various forms of additional income. So in this case, this lady has created a roadside stand, and she has a farm, but this is on the edge of the farm on a road, and she's able to make extra income. She's one of the success stories, by the way, because she got loans for a couple of years and then finally said, you know, I don't need any more loans because now I've figured out how to make it work. And so she's now an advocate to help us reach out to other women in the community who are looking for assistance. So I'll just go to the last slide. So right now, the Smallholder Farmers Alliance operates in 7 areas of the country. And in those 7 areas, there are a total of 32 tree nurseries, because every farmer has to be able to walk to a tree nursery to be able to do their volunteer service in order to earn those credits. So I just wanted to highlight a couple of things before I wrap up here. Number one, the whole emphasis of our operation is at a community level, small rural communities. And it turns out this is a tremendous advantage under the current situation, because even during Petilock last year, during the lockdown operation, our farmers were able to continue their work at this local level, unhindered to a large degree by the larger meltdown in the country. And even now, the farmers are able to continue operating. We've got washing stations based at every one of the tree nurseries. And there will be some implications, obviously, for COVID-19 on the work. But because it's locally based, it's able to continue. The other thing that's very important to take note of, as Bettina was referring to earlier, in the midst of the coming food crisis, suddenly we have the advantage that as the country begins to address the need to increase local food production, because at the moment Haiti imports between 50 and 60% of all food consumed in the country, suddenly that food access is going to go down, and there is a new emphasis on increasing food production in Haiti. And what we have created is a very direct way to at least approach a 50% increase in food production by every one of the participating members in the Smallholder Farmers Alliance, and to do so in a way that is sustainable over the long term. And to finish up, I just wanted to alert you that we have begun to reintroduce cotton to Haiti, which is a very exciting thing in the midst of all the challenges that Haiti is facing. And so the cotton being grown by a portion of the Smallholder Alliance farmers is going to be appearing in the first products that we're developing with Timberland. And so one of the bright spots in the economy of Haiti, in the midst of everything, is that there are going to be 2 new lines of shoes produced from cotton grown by smallholder farmers in Haiti on the shelves in spring 2021 for the first time in 30 years, because we've been able to reintroduce cotton and begin to use that to reinforce the resurgence of the rural farming community in Haiti. And we're grateful to be able to do that in partnership with the Raising Haiti Foundation, and we look forward to including more of the Parish Twinning partnerships to be able to build that even further. So there is a potential for significant impact, even in the midst of the challenges we're facing with COVID-19. Thank you.
Thank you so much, Hugh, and to Timotei as well for your amazing work. Have an opportunity to learn a little bit more about that in just a moment. But right now, I would like to introduce and bring on someone who's become one of my favorite people. I enjoyed working with her so much over the last number of months. Diane Huggins, a member of the Haiti-CPR Consortium Strategy Team. She's the secretary, most of you know her, of the PTPA Board of Directors and co-leader of the Haiti Mission for Our Lady of the Lake Catholic Church in Hendersonville, Tennessee. One of the first U.S. Catholic parishes to form a twinning relationship through PTPA, serving the St. Bertin Parish for almost 40 years. Diane is very passionate, committed to the people there, and has visited them 26 times over the last 19 years. Diane, welcome.
Thank you so much, David. I appreciate that. It has really been an honor for me to be a part of this strategy team. And I want to express my heartfelt gratitude, not only to David, but also to Sue with Raising Haiti Foundation, and also to Hugh, Timotei, and Godinson with Smallholder Farmers Alliance. They are the ones that have made this happen. And working with this consortium has helped me to realize just how important it is to work together in collaboration when you really want to make something meaningful happen. So thank you all for everything that you've done. And I'm very grateful that my twin parish, St. Bertin, was one of the pilot communities. And I want to read to you the report that was written by Marc-Endy who was our community leader. And it clearly demonstrates the incredible impact that this program is having. We would like to thank the board who organized this wonderful program to help the people understand and learn about what the coronavirus is truly. We had a training information call with the doctor on the first day. We started with the teachers. We learned a lot. We touched approximately 30 people to help us teach 1,000 other people. The people in our community did not understand the gravity of this virus. With the training, they start to believe it. But the teachers are afraid to go everywhere because of lack of materials like masks, gloves, and hand sanitizer. We would like to do more. Now the people are starting to have knowledge. Thank you all for all you are doing. So this message is really a good lead-in to some important information that David is going to provide. Thank you.
Well, and thank you, Diane, for sharing this. I think, when we read this together for the first time, we all remarked that this is to the heart of the story and what's happening. So thank you so much for being so close there and for connecting us in that way.
My pleasure.
I'd like to ask Sue, Dr. Carlson, to just join me here. We're going to just take a few minutes and chat about an initiative that we've been working on for the past year or so, and together with the Smallholder Farmer Alliance and also the Parish Twinning Program of the Americas. In fact, we were ready to, we kind of had a couple of tests where we've rolled this out. You'll learn in just a minute about one of those. It's already happened. We were ready to do it, and then of course COVID-19 came along, and we realized that that was not the time to start talking about a new venture. We needed to get to work on everything we could do to help mitigate that problem. But we're talking about an initiative that we call community twinning. And we know we have a lot of parish twinning affiliates on the line. I get a little emotional, I'm sorry, thinking about it, because you guys have just done amazing work over nearly a half century. And I think that, it's time now for us to help you take your story to the larger community. We've learned over time, working closely with Teresa and Diane, that it's really a challenge. I mean, each of your churches, some of them have worked for 30 and 40 years and more, supporting a given community. We learned today from Bettina, I mean, the Haitians don't seem to get a break. It's one crisis, one catastrophe, one problem, one challenge, one struggle after another. And it's hard work to have done the kinds of things you've done, and the relationships you've maintained are critical and very important. And we think that there's a way for you to take that story to everyone you know, and not only you, but other members perhaps of your parishes that haven't been as involved in the process, but love to tell a good story. And all of you should really be very proud of the work you've done over the last almost half century, as I said. And, it's the notion of community twinning is really just taking your vision and sharing it beyond the confines of the church and inviting others to walk with you, to work with you, to help increase the possibilities. And we think that the Smallholder Farmers Alliance's programs that really empower the farmers, that's the bottom line, that empower the folks on the ground. This is really what is needed. This is sort of the missing link. It's an economic piece. Sue, talk to us a little bit. I know from the time you came on with Raising Haiti, you were concerned about, whether you would be maybe giving up some loyalty to Our Lady, Queen of Peace. But, and I think that maybe posting in the chat box is a link to an article that's written about Sue and parish twinning, because the reality is when we work together, there's ample abundance, where there's more that's added. Tell us a little bit about your experience and what you've done in the last 48 hours.
Thank you, David. Well, I was worried after working with St. Joseph Parish of Maydor through the Parish Twinning Program that if I joined the Raising Haiti Foundation as their executive director, that there would be a conflict of interest, that because my heart is with Maydor, and I just didn't see how I could do fundraising or whatever for Raising Haiti Foundation, because I was trying so hard to help the people of Maydor. But I find that working with Raising Haiti, the assets to Maydor have increased. They were able to be part of this training program because of Raising Haiti Foundation and Smallholder Farmer Alliance. We've been able to work together to raise additional funds. We were able to have a microcredit program that's in the process of being started in Maydor because of the Raising Haiti Foundation. So working outside of the parish has only increased the amount of assets that our parish has been able to provide to our twin parish in Maydor. And David asked me to do a trial to see if I could ask people outside of our parish if they would donate to our parish work. He asked me that a couple of days ago, and in a couple of days, just by asking people outside of Our Lady Queen of Peace if they would donate to our work, I was able to raise $5,500 just by asking. So I was pretty pleased about that.
And I know, from the time that we first met, I know one of the things you've had in your heart, because you have been such an amazing asset in Our Lady Queen of Peace. You've worked with others, but you've been a true leader, moving and shaking. You guys have raised millions of dollars over the last couple of decades. You've built schools enough to educate 3,000 students a year. You have 10 of SFA's tree nurseries. You've planted, what, 1 million trees perhaps?
Not yet.
Not quite 1 million,
Yeah.
how many? 700,000?
740,000.
That's a lot of trees, and especially considering that Maydor is so far off the beaten trail, as it were. You see, this is a road to Maydor in your background, right?
Yes. Yeah.
Yeah. So really what we want to try to do, and there's not a lot of time to talk about it and focus on it right now, but what we want to try to do is develop some resources. Go to the, it should be posted in the chat. Check out the article about Sue. It's you can Google it. It's Haiti, COVID-19, and the Universal Law of Abundance, and learn more about the program. We're going to be talking about it. We're going to have another chat, probably following up in about a month. But right now, we'd like to ask you also to think about community twinning. Think about folks outside of the church, and you can share. You just tell them your story. You've been doing this for a long time. People need to know about it. Really, all of you should be nominated for a Nobel Peace Prize, in my mind. I mean, just the diligent work you've done for so long, and it's a story that absolutely needs to be told. And you can begin telling it by helping us with a little bit of a dilemma we have with COVID-19. If you could start bringing up these slides. I'm not sure whether it's Joe or Boyd, but yeah, let's just see what we've got here. So we were able to raise $100,000 in grants, which have provided for so far 21 SFA communities. That's where this process started, and 50 Parish Twinning Program communities. And the staffing, the logistics, the Tanama National, the amazing awareness campaign that has come together. And we've got those funds secured, and we're moving on that. We need another $40,000 to complete an additional bit of staffing and 50 additional communities. These are primarily, there may be some others, but I think they're primarily Parish Twinning Program communities that have signed up for the kits and for those trainings, follow up, and again, additional kits for previous communities. So we're going to ask you to help us in that regard. An additional $40,000. We didn't ask for anything in the first chat, but we really want to keep this process going. And if we do better than this, we'll be able to reach even more communities. So this is an urgent need right now. We need $40,000 to complete Haiti-CPR, what will be 121 communities. All gifts made are tax deductible, and 100% will go toward COVID-19 prevention in Haiti on the ground. We've decided to take no administrative fees for any donations that are made for this emergency. And I can tell you all the work that's been done, including just tireless work by Sue as our executive director. I don't like to use the word volunteer because I've never seen a volunteer do a tenth as much as Sue does, but she works for free, and a more committed person I've never met. We need $40,000, RaisingHaiti.org. You can go to the donate page, ask other. One of the things that we try to do is match funds. You may want to think about getting a small group of folks together in the church and that would be willing to maybe put up $2,000 or $3,000 or $5,000 if your friends would match it. It would give an equal amount that you would match those funds. It's a very powerful way to get people engaged in the process. And we encourage you to help us complete this task that we are committed to here in Haiti. And we thank you all very much for all that you have done. And one last thing I'll just mention to you, if we're looking right now for community twinning leaders, and when we started thinking about it, we were thinking about those leaders outside of the church. And if there are people listening that aren't engaged in a PTPA relationship, we're speaking to you as well. But then we realized, what better leaders could there be for community twinning than the folks who have been doing this for almost half a century? That it's moving what you've done, and people need to know about it. Don't hide it under a bushel, because the needs in Haiti are great, and you guys need support and help, and you deserve that as well. So with that, Sue, would you like to just share any other thought?
I think you summed it up, David.
Okay.
Thank you.
Thank you. Well, what I'd like to do now is to introduce Sister Pat Dillon. Sister Pat is a member of the Religious of Jesus and Mary and has been working in rural Haiti tirelessly for the past 22 years. And Sister Pat will lead us in a closing prayer. Welcome, Sister Pat.
So we pray. May we who are merely inconvenienced remember those whose lives are at stake. May we who have no risk factors remember those most vulnerable. May we who have the luxury of working from home remember those who must choose between preserving their health or making their rent. May we who have the flexibility to care for our children when their schools close remember those who have no options. May we who have to cancel our trips remember those who have no place to go. May we who are losing our margin money in the tumult of the economic market remember those who have no margin at all. May we who settle in for quarantine at home remember those who have no home. During this time when we cannot physically wrap our arms around each other, let us find ways to be the loving embrace of God to our neighbors. Amen.
Thank you so much, Sister. You know, this has gone a little bit over, but last time we stuck around and a lot of people wanted to stick around and had questions. And I see there are 20 questions in the Q&A box. So we will take a brief intermission here, enjoy a song written especially for this initiative by Canadian composer Jack Lenz. And at the end of the song, those who would like to stick around will be happy to chat a bit more, questions and answers, and just some general conversation perhaps about community twinning. And if you have to leave and you're interested in learning more about community twinning, simply send an email to RaisingHaiti.Chat or RaisingHaiti.org and just write community twinning in the subject line. So enjoy the song.
This I wish for you, to live in unity and peace. This I wish for all of you, to be as waves of one sea. This I wish for you, to live in happiness and love. This I wish for all of you, to be as flowers of one garden. We strength. This I wish for all of you, to be as stars, stars of one heaven. We are now all global citizens, citizens of one world. This is the time for love and unity, justice, all for peace. We're all one in this. We're all one in this. We're all one in this. One world, one world, one world. We are all in this together. No borders do we see. All of us in this together. No differences between you and me. We are all in this together. We are all in this together. We are all in this together. We are all in this together forever. We are now all global citizens, citizens of one world. This is the time for love and unity, justice, all for peace. We're all one in this. We're all one in this. We're all one in this. One world, one world, one world. We are now all global citizens, citizens of one world. This is the time for love and unity, justice, all for
Thank you, Jack Lenz, wherever you are, and welcome back. We still have quite a number of folks. So
Section,
here's a
guys.
question from Wendy Langer. This would probably be directed to Godinson or Sue. How many have signed up for the CPR training? How many communities?
Yes, I can answer that. So far, we have received 85, but we probably might have some job off as where the response on some communities are not reachable. Maybe their numbers are not correct, but it's what we have now for from the communities.
And that's in addition to the 21 that were the SFA Smallholder Farmer Alliance communities that started the whole thing off. So 85 plus 21.
Okay.
Yeah, correct.
Here's a question. How do we follow up and make sure our parish is actively participating in the CPR? I assume that means if there's a parish that has in fact signed up. This is from Robert Afimba. I'm not sure, if it needs to be.
I'll take that. I'll take that. Hi, Bob.
No, it's actually Wendy Langer. I'm sorry.
Oh, okay.
Wendy.
I'd encourage panelists to turn their cameras on if they want to. This is a good time if you want.
That sounds good. Let's do it. Welcome back, everybody. Diane, Hugh, Godinson, Timothée. Why no? Okay. Teresa. Go ahead and take that question.
So, well, I can just start. I know what I do, and I communicate with the priest and the other people that I know in Major that I know are involved with the training, just asking how's it going? Are the community members learning about the social distancing and all of the various things that are taught in the training? So it's just communicating with your parish.
Okay. Here's one. This is from Robert. Do you plan to include the 2 of 10 am I pronouncing it right? Pronounces that are missing from your current schedule. So two of the departments, I guess, that are missing from the schedule.
There's the NIP and the Northeast, and I think we haven't received requests from them. Yeah, so we are happy to have them on board to cover all the departments.
And again, depending on the fundraising that we're looking for, if we do better than we are asking, we hope to be able to add additional possibilities. What do you make of an alleged report that Italian doctors have mistakenly performed autopsies on COVID casualties and found that COVID is not a virus, but can be treated instead with antibiotics? That sounds like a fake news that's floating. Let Nat take that one.
Yeah, I just think I'd be surprised if that turned out to be true. So I think all the evidence so far looks at it is, virally mediated. So that's what I would say to that.
We have another question from Wendy. Even after the COVID-19 pandemic, would you be interested in continuing these informative web meetings? And the answer is very much yes. We're hoping to follow this one up with a conversation about community twinning and, to keep in touch on the ground as well. Here's one from Bob Goddard. We in Hero are involved in community twinning in Belle Anse through Community Director Becker Descoline. I guess that's not really a question, but that's good to know. Thank you for that, Bruce. Let's see here. We're being told, maybe someone wants to make a note, Rotary clubs could be a good resource to tap into, I assume, for the community twinning idea. I think that makes sense. Here's a question: can you define community twinning? Well, I can take that one just briefly. And think in terms of all the work as parish twinners that you have done over the decades. Close your eyes for a minute. Envision the number of folks that attend your church, and now imagine everyone in your city being a possible resource for this. And what community twinning will simply be, will be taking this message of what you've done to sources like the Rotary Club, to your friends, neighbors, business associates, and so forth, and asking them to help. And we're going to be providing a tax-deductible vehicle through the Raising Haiti Foundation. And let me mention as well, we are working right now with the Timberland Corporation. We are working with the Julian Grace Foundation. The Julian Grace Foundation provided $100,000, which in two separate tranches, which is what has funded this program, as well as potentially the Clinton Foundation and others. And here's what we're asking them to do. We're asking them to match the funds that you are able to go and raise outside of the church, independent from what you've already been doing over the years. And we think it's going to be a very powerful engine. If you want to know more, we can talk with you in more detail. Please send an email to S. Carlson at RaisingHaiti.org, and just put in the subject line community twinning, and you'll hear back. Will a video of this chat be made available so we can share it? Josefina, you want to just take that for a minute? You're on mute. So we can share it with Parish Haiti ministry team and perhaps others in the larger community. We need to think in terms of the wider community. Go ahead, Josefina.
Yeah, so this has been recorded and we're going to be posting the full video early next week. It's also being live streamed on our Facebook page, Raising Haiti, just Facebook/Raising Haiti, and you can also reshare it from our Facebook page. We are also going to be sending out a newsletter next week where we'll include the link to the video.
I have another question from Bruce Goddard, and I'm really grateful for this question, Bruce. If one does not have a twinned parish, but a twinned community in Haiti, how would that community get involved in the SFA program? Again, please send a note to our executive director, S. Carlson at RaisingHaiti.org, and you can write community twinning, or you can write SFA information. And absolutely, the initial, there are right now, I think Hugh tell us 30 some odd or 40 some odd tree nurseries, and just a number of those are in PTPA related communities, and many of them are not. And of course, we will be delighted to talk with anyone about that. How many tree nurseries do you have that are not connected?
Oh, well, there are 32 nurseries spread across 7 different locations throughout Haiti. And we're in the process of identifying some new locations to be able to expand over the course of the next year. So we have some flexibility in that.
Bruce, if your question was related to how your twin community can be part of Haiti-CPR to receive the training and the kits, just contact me and I'll send you the form that you can fill out. You don't have to be part of PTPA to be part of the Haiti-CPR training.
And there are some amazing possibilities that are just about to unfold. Hugh, talk a little bit about your engagement with Timberland and the commitment that they've recently made this past September, which is going to drive the quadrupling of the number of farmers that need to be engaged in this program over the next few years. Tell us a little bit about that.
Well, the Timberland Company, they were our original corporate sponsor back in 2010 when we started. And they continue to be a sponsor in addition to becoming a client at the same time on the purchasing cotton side. But they made a commitment last September to planting 50 million trees worldwide over the course of the next 5 years. And half of those 50 million, 25 million of those trees are going to be planted through the Smallholder Farmers Alliance over the course of the next 5 years in Haiti. So we're looking for partners to work with where we can put a small amount of funding towards a joint initiative where we can see tree planting to help us meet our goal. And then at the same time, that ends up directly involving local farmers in the basic tree currency program.
I have something here from Maurice King, representing Tell for Kids, actively providing clean water to fight COVID-19, been in Haiti for at least 15 years, providing technology education in Jeremy, wants to know how they can become a partner of the consortium. Is that something that I'm sure you're seeing at Sue? Josefina, make sure that Sue gets this. And Maurice, if you're still on the chat, please do send an email directly to Sue Carlson. Again, that's S. Carlson. I'm learning your email address by heart here. S. Carlson at RaisingHaiti.org. So let's see. We have a lot of people thanking us. Here's one, a parish that does not have good internet. I'm sure there are several of them, and this questioner wants to know how they might be able to get involved in the process. Thoughts on that, Sue or Teresa?
Definitely to get involved, I think you don't need to have internet. Just a phone to be able to receive the training.
I'm having difficulty.
He was just saying that basically they just need a phone. They don't need internet.
Okay.
But they do need a phone.
So again, reach out, S. Carlson at RaisingHaiti.org.
And David, I was just going to add that my parish doesn't have internet access either, and they've been able to participate in and everything. So just a telephone is needed.
Okay. Well, I think we've kept everybody long here, and I think we've addressed most of these questions. If you did not get a question answered, again, S. Carlson at RaisingHaiti.org. Keep posted as well, because we will be back with information about this the next chat. We'll be talking more about community twinning. And in the meanwhile, please don't forget to visit RaisingHaiti.org. Donate to help us shore up this gap so we can get to all of the communities that are on our list. But anybody else like to? Let me just invite each of you to have a few last words. Let's start with Nat. If you don't raise your hand, I'm going to call on you. So go ahead, Nat.
You're on mute.
Sorry. Yeah. Thanks, everybody. And I think the next couple of weeks are going to be critical to see just how bad it's going to be. How bad it's going to be there. But thank you. I think the parish twinning thing is a very powerful mechanism of educating people and, helping people access care and education. Thank you.
Thank you, Diane.
I just wanted to thank everybody for being here, but I saw one comment that asked about what logic we use in selecting communities for the training and the kit distribution. And I just wanted to say that all it takes is a community who's committed to participate. There is no selection process. So all you have to do is enroll your community, get the support of the pastor, make sure you have a community leader, make sure there's a telephone, and that everybody's committed to participate in the program.
Please finish. I'm sorry.
Yeah, that's it. So if you have an interest, just let us know. Email Sue and let us know.
Yeah, this has been a process that's been going on for the last few weeks, and it's the logic has been first come, first serve. We've got a number of communities we need to get to. We're trying to raise as much as we can to add more. So reach out to Sue if you have a community that needs to go on that list. Hugh, anything for us?
Well, just to say that even while we're in the midst of the challenges that Haiti faces, not to lose sight of the power of focusing support at a community level, because that's where change can happen, where change can be sustained, and where the most people can be impacted.
Thank you, Hugh. Teresa, what have you got for us? You're on mute. You're on mute, dear. There you go.
Better that I don't be heard. No, just it's been wonderful working with this task force. You all have just been so great, and I appreciate all the work that you've been doing. But also, I just want to thank any of the parishes out there who are listening and who have participated, and encourage those who haven't to just notify us and let us know. It would be wonderful if you can bring this to your community also. So.
Thank you for that. Timotei, what have you got for us? I know your audio was a little bit challenged. Let's try it.
Thank you, guys, and especially to the sponsor who make this program possible, and a special thanks to our attendees today. So be safe, stay well.
Guidanson? On mute. There you go.
Yeah, thank you all for joining us today for this chat. And as Dr. Timotei mentioned, we appreciate everyone who sponsored this activity. We are going to get very busy for the next couple of weeks, so with the training being done. So thank you for everyone who will be receiving, or those who have received, get to the work on the field and share the message to the people who are really. Thank you.
Thank you. Sister Pat, what have you got for us here?
Yes, just thank you for all the training that's come to the parishes in Gramont, and we look forward to the parishes that haven't gotten the training yet being able to share in that. Thank you.
Thank you so much. I'm going to ask Boyd and Josefina to turn your cameras on. I know, Josefina, you detest doing that, but let's take a quick look, and thank you both so much for all of the technical help and support. We definitely could not have done this without you. Where are you, Josefina? There you are. Okay, that's our crew, guys. Excellent. I hope I didn't miss anybody. I don't know that I'm looking at every image on here. Is there anybody still with us? I know Bettina left that I haven't called on. I would hate to do that and exclude anybody.
I just wanted to say Happy Mother's Day again to all the mothers in Haiti.
From one mother to the mothers.
That's right.
Okay.
Right.
Well, again, stay tuned. Check out Raising Haiti, especially the donate page. And we'll be back with you soon. Thank you all for coming.
Thank you, everyone.
Thank you, everybody.
Bye. Bye.
A little exit music.
Thank you. Bye-bye.
Bye.